Hey guys, welcome back. Today we're going to talk about the trans movement. Are you ready to hear about my views on the trans movement? You're not, because you're sick of this topic? Well, too bad. I have some views that I think may be important. Some things I'm going to say you probably heard before. We'll try to skip through that as quickly as possible, but I think I have a perspective here. And ultimately, the reason why we're talking about this cultural issue is because this means something about us. Not about us like other people, culture in general, but me. This means something about each one of us that this is a prominent cultural issue. And you say, oh, CNN just talks about Dylan Mulvaney to distract us from all these proxy wars. Yeah, okay, maybe that's true. But the reason why they would use this topic as a distraction is because it still means something about us. So let's learn. Right? Let's look out to look in. Let's look in to look out. Well, now we're looking out to look in. So let's get to it. Outline, I'm going to go over context, why the trans debate matters. It's kind of the same section. Then what evidence is there for transgenderism? There's really not much. And yeah, why the evidence really doesn't matter anyway. And we'll talk about that. There's an alcoholism analogy here, which I think is most apt. The trans movement as a trauma response. I'll look at it from that perspective. Some miscellaneous thoughts. I was watching Natalie at ContraPoints, this trans woman at ContraPoints. I take her as like an amalgam of a reasonable pro-trans movement position. So somebody who you can talk with and, very reasonable, a lot of overlap in her views. So I have some thoughts on things that she said. Then a quick summary of my views and takeaways, what this means about us. Like, what are we going through if, having Dylan Mulvaney means so much to us? It's like a Bud Light spokesperson, or not having her as a Bud Light spokesperson. Like, what does that mean to us? Like, why is that? I don't know. I think it's interesting. And, Animus Empire, we're going to talk about animus integration, of course. So context. So I listened to part of the Witch Trials of J.K. Rowling, the podcast that came out earlier this year, last year, doesn't matter. And Natalie, who is from ContraPoints, the YouTube channel. It's an interesting YouTube channel. I'd check it out. Natalie was on the podcast. And then she did a YouTube video about that. I watched that YouTube video. I'll link in the description. I suggest you go through it. And I'm not going to go through all of it. That would be tedious. But if you want, it's just a good perspective. These are my suppositions about transgenderism. I could be wrong. Again, I really don't think we have enough evidence to say. I mean, I think we can infer something from the evidence, but what is actually going on in trans people that makes them trans? Because I really do think there are trans people. Well, what's going on there to make them trans? We don't know. We have much less evidence for that than we have for something like homosexuality. And then, of course, I mean, this is like, this sounds just patronizing, or I don't know what the word is. Yeah, patronizing whenever I say stuff like this, but this is not a condemnation of any trans people. This is a condemnation of the trans movement, how it's become a political movement. It has. It's a condemnation of that and the beliefs of that movement. Not any one particular transgender person's belief that they happen to be in another sex body. Right? These are two totally different things. And I think that the inability to distinguish between these two totally different things says something very real about the movement itself. So why this debate matters? Well, I think it's the thing that our Weimar-esque... I should be checking these off, right? Yeah. I think this debate ultimately matters. The trans debate matters is because it's the thing that our Weimar-esque ideologies want. The left needs it. I mean, it is like a perfectly crafted movement for the left because it just hits all their buttons. There's the oppressor versus the oppressed. Oh, now there's a new oppressed group, trans people, that the left gets to prop up. We can base it on social constructivism. We can say, oh, look, you can choose your gender. It's just a social construct. Nothing's based in biology. There really is no human nature. Human nature is just what society makes it to be. And it allows for a push for more federal control because these dumb, redneck, Wyoming backwater states, they're not going to have the right trans bathroom policies in their local schools. So this is more of an excuse for federal overreach because we in the government just know better, just got to get the right people in charge, the West Wing fallacy. But the right needs this too, because the right always looks the smartest when the left is the dumbest, because the right has no ideas. They have not had an idea since Goldwater. Sowell. I mean, but Thomas Sowell wasn't really a politician. But really, since Goldwater, there's just no ideas coming out of the right. And so they need the left to look stupid, and they can just point to the left and say, well, look how stupid they are. We're not that dumb. So come and follow us. And the right says, no, well, we do have ideas. It's called God and religion. No, it's God and religion as you have seen it in the past. It's God and religion from this like projected view of how it used to be when we didn't have as much knowledge. I mean, just to put it as bluntly as possible, when we didn't have as much knowledge, and that we're not going back to that kind of religion where you can just say, oh, Satan's causing you to do that, and that's wrong. No, because now we have enough knowledge to say, well, how do you know Satan really exists? Now, I do think God and religion are important, not as we saw it in the 19th century, but it is important. How do we integrate that into what we know today? But the right's not doing that. They're just saying we need to go back. Believe me, you don't want to go back. That would be the worst thing. If we actually did go back, what that would mean is that there was a huge cataclysm, a reset of society. I just got to be in my bonnet about this because I saw this tweet this guy made, and it got a lot of likes and retweets and stuff. And he said, look, what's going on in the trans movement and how they're trying to groom our children, I can't chalk it up to anything else besides Satan. Dude, it's that kind of reasoning that made people trans in the first place. They're like, this is a burden. Your ideology is a burden, especially when you can't explain it, especially when you think saying Satan is an explanation. Checking off these as I talk about them. And then, people say, oh, dude, it's only a small fraction of the population. Not many people are trans. Yeah, but it's symbolically important. Like Terry Schiavo, this case in the 90s, this woman was brain dead. Like, was she still alive? Is she still a human? That this made us question consciousness and how it relates to human life. And can a human be alive? Can a human have humanity without consciousness? All these great questions. Oh, it's just one case. But yeah, it means a lot. Same thing with Elian Gonzalez, this immigration case in the 90s, I think. And now, it's just like, it's made us question immigration. We don't have to get into it, whatever. But plus, it's grown a lot. There's like people say it's a contagion of trans kids going on. I don't know if I'd go that bad. But also, this is like one of the first things that indigenous people distinguish, is the distinction between men and women. And so I think that's very... It's very, I mean, even before they distinguish between the outside world and the inside world, they distinguish men and women. So I think that's telling. There's this quotation, the wars between nations won't end until we end the war between the sexes. I think I'm still stealing that from somebody. I'll just take it until somebody claims otherwise. But yeah, you think that caring about, what's going on in Ukraine and Syria or whatever, like that's more important. That stuff is a reflection of this. And plus, of course, it's always an epistemological issue. This is what subjectivists do. They take freak occurrences, in this case, like intersex people, and because they're these freak occurrences, borderline cases, they use that to discredit the concepts. So, like colors, I say there. When does orange become red and when does it become yellow? Right? You can't really say exactly. There are these borderline cases. It's like a yellowish, orangish kind of thing. I don't know. Like a burnt orange. I don't know. So because you don't really know when yellow becomes yellow, yellow's not a real concept, or red's not a real concept. This is classic tactic from the subjectivist crowd. Okay, so let's look at the evidence for transgenderism. And by this I mean evidence that suggests that this one thing or this one part of biology or who you are causes you to be trans. And right now, we can't say for sure. There's way too many confounds with trans people anyways, because they just tend to have a lot of issues. I mean, nobody denies this. I mean, the higher rates of anxiety and depression and suicide. Trans people are more likely to sexually assault children. I mean, that's true. That's why people don't like you saying that. Well, because it is true. I mean, it's not that much more likely. It's not like, we'll get to it when we talk about alcoholism. I don't think that's that big of a deal, I guess. They're much more likely to be sexually assaulted when they were children. Now, what's causing them to sexually assault children, or what's causing them to have the anxiety? What's causing all these comorbidities to show up together? What causes what? Now, of course, the trans movement would say, oh, it's a social stigma around being trans that, makes them anxious and, and that's why they want to commit suicide. Well, maybe that's a hypothesis. You don't really know. So who knows? Between 5 and 10% do want to detransition, and even the numbers on that are kind of, I don't know. There's no, when I look at something, when I look at evidence for something, and that's why I don't even cite anything, because there's really nothing worth citing. From my perspective, if you find something, let me know. But there's really no robust study with high-end, longitudinal, definitive study like that with trans. I would be very interested to read it when it does come out, because I'm sure it will. So until then, it's just like, well, what are we even looking at here? Are we looking at anxiety, or are we looking at transgenderism? Are we looking at depression or transgenderism? We don't know. Yeah, trans is part of a lot of philosophy, but my takeaway is the gist that I got from all the evidence is that transgenderism is like homosexuality. Though there's less evidence for it biologically, that there's like something scientifically that causes you to be trans, like we have for homosexuality. There are, things like that for gays. So there's less evidence for it, and at the same time, there's greater severity of comorbidities. What does this tell you about the relationship between trans and homosexuality? We'll get to it at the end. That's just a question to think about. And then I was thinking about taking this in alcoholic analogy direction because I was watching a drag show, as I tend to do, and it kind of made me think of, well, it strikes you as frat guys doing a prank. It strikes you as frat guys getting drunk, getting up on stage and dancing around, basically making fun of their girlfriends. It also reminds me of there's like a fighting style called drunken kung fu, where you just do kung fu like you're drunk. And it probably came about because some guy who was pretty good at kung fu got drunk and fought a guy, and he realized he was even better after he's had a few, because his inner critic is not as powerful. There's something going on out there. I was like, wait a minute, are these drag shows? Is this just people being drunk? Is this their version of being drunk? Like their way of acting out, like what a drunk, essentially what a drunk is somebody who's like, existence is such a stress. It is such a burden on me. Existence feels like such a burden on me. I need to tune out with alcohol. And is that what a drag show is? Is that what transgenderism is? Gender is such a burden that I need to just completely flip, completely compensate, and do a ridiculous impression of whatever the opposite gender is. Another thing with alcoholics and trans people is they're both more likely to abuse children. I mean, people, just get this in their mind, like, oh, you say that trans are more likely to abuse children? Well, the next step is to put them into ovens. No, but we don't do that with alcoholics. If you're going to invite somebody over, if you're going to invite a family member over to watch your kids, is it going to be, Uncle Benny who swear he hasn't had a drink in 2.5 months and he's serious this time, and oh no, he really feels that this is the time? Or your cousin Ed who has a family and is like an accountant and he can hold a job, and who are you going to invite? Now, what are the chances? How much more likely is it that, or how likely is it that Uncle Benny's going to abuse your kids? Not very, but comparatively. right? So it's not like just because you're from a demographic that's more likely to abuse children, we don't just want to. It's just, look, Natalie from ContraPoints, I just got the sense like that was just the word. You couldn't even utter that. To utter that would be ridiculous. Oh, it's like you're saying you want to put everybody in ovens. No, it's just, we do this, I don't know. Now, if there were alcoholic inclusive bathrooms, it would be okay. It would be understandable why somebody would be a little bit hesitant to take their daughter in a bathroom where, you know, alcoholics are included. Now, most alcoholics, first of all, you're not drunk most of the time. Well, no, maybe you're drunk most of the time. But most alcoholics, I'm sure when they go into the bathroom, they don't puke in the urinal. Most of the time. There's a higher chance that they will. I don't know. I think it's okay for people to be sensitive when it comes to their children. Let's not say they hate you because they just want to be a little bit protective. And maybe it's nothing against you. It's just, not a bet they're willing to take. And if a library didn't want to invite you to do alcoholic story time, where you show up drunk, and you can invite an alcoholic to do story time, but maybe you would understand if the library didn't want you to show up drunk. It'd be kind of weird. You don't want to traumatize the children anymore, and children are really agreeable. Children will just go along with whatever. So if they think, oh, this is how adults are, okay. It's a huge part of working through neurosis is these things that you accepted as just true, just truer than true, and it's actually not. Okay, so we'll go through there. And yeah, trans people get attacked. Does that mean they're getting attacked in society? I don't know. Alcoholics get beat up more. Again, where do these attacks come from? Is it because they're being attacked because people don't like trans people, or are trans people more likely to be in situations where they're going to be attacked? Same thing with alcoholics. Do we just not like alcoholics? We just want to go around beating up alcoholics? Or are alcoholics more likely to be in situations where they get beat up? And there's a lot of likening of the trans movement to the gay movement, but it may in fact not be that. It may be more, the more apt analogy here is to the deinstitutionalization movement. Because what happened is, in the middle of the 20th century, psychology lost the moral authority to tell people when they were, when they could reality test properly. We lost that moral authority. We looked at somebody who was schizophrenic and said, oh, who knows whether that's a better way of interpreting reality than how my brain. In fact, maybe schizophrenia, maybe that's a better way of dealing with reality. Plus, we can't even point to schizophrenia in the brain. Well, we can now, but we couldn't then. So it's not real. The myth of mental illness, Thomas says, I've talked about that a lot, which led to the deinstitutionalization movement, which led to a normalization of people in society who cannot reality test well, which is an issue in cities, if you've ever been in one recently. And is the trans movement the same thing? Now, maybe it's the gay movement where, it looks like there's some genetic component here. This is who you are. We get it. There's always going to be gay people. There's always going to be trans and cross-dressing and stuff like that. And so we're just going to be more likely to accept you as part of society. Or have we just lost the moral authority? Are we continuing to lose the moral authority? Right? The first distinction we make is between male and female. The second distinction we make is between mind and reality. We've lost the distinction in psychology of making between mind and reality. That is no longer a question of who's to say. But now we're doing that with a more fundamental distinction between men and women. Okay. So the trans movement as a trauma response, just watching Natalie's videos, I'm just going to get through this. On ContraPoints is, it's just typical trauma response is you feel like you're being attacked. You feel like your existence is being criticized and questioned just because somebody's criticizing you for something. A complete overblown reaction. I mean, this is it's all shell shock. Just think of all trauma responses as shell shock. You've jump under the bed when somebody slams the door a little bit too hard. Yeah, I know it feels like a bomb just went off. And I don't want to delegitimize how important that is, but also a bomb did not go off. You're not being attacked, just being criticized. Your ability to participate in a society is being questioned. No, you feel like it's being questioned because you cannot validate yourself. So you need people to take you as seriously as you take yourself. And if you don't validate your existence, then it's bigotry. Well, it's not bigotry. It's just we just want to ask questions about what you're doing. You talk of rights. This is just more of the same. What rights don't you have? They just want mandatory coverage, and equality means, oh, no, you got to pay for whatever I want. Well, that's not really equality. But in here, I sense this resentment of you owe me, right? I have the right to your money because I feel like a millionaire. You owe me. Gender is, this is how traumatized people talk, right? So what the trauma story, the general trauma story is existence as a burden. I guess this kind of relates back to the alcoholism thing. Existence as a burden. I didn't choose to be part of existence. I didn't choose to be alive. You hear this all the time. I didn't choose my parents. I didn't choose my gender. It's a burden. And so maybe, it can be helpful for you to cross-dress, to be an opposite gender. I could totally see how that's, therapeutically valid. But also, we got to look at it as trauma. A lot of arguments here about projection. So what trans people say is, oh, well, you don't really know how it feels to be trans. Well, yeah, that's true, but I could say that about you. You don't really know how it feels to be cis and listen to you talk about trans. It seems ridiculous to me. I could say that both ways. Right? Well, what you're saying is your view is ridiculous to me based on how I feel. Yeah, that's what I'm doing too. Your view is ridiculous to me based on how I feel. Now, I'm at least doing the work and saying, well, I could be wrong about this. All evidence points to, well, there's ideological evidence and psychological evidence here that point in one direction to my view, but the evidence, the scientific evidence in the future could point another way, and I'll happily change my position. It's not going to change how I treat trans people with respect and dignity like you treat anybody else, obviously, but my views will change. Yeah, like when men have views on abortion, right? People say, well, can men even have, well, I don't know, can trans men have a view on abortion now? That's an interesting debate. But, you can't have a view on abortion because you're a man, you'll never know how it feels to be pregnant. Well, I could say the same thing about you. You can have a view on abortion because you're a woman, because you will know what it's like, or you do know what it's like to be pregnant. You're too close, right? You're too close. You need some perspective. You got trust a man's perspective here because it's too emotional for you. There's a lot of miscellaneous arguments here, like a big comparison between J.K. Rowling and Anita Bryant. Just because people are against movements, it doesn't mean there's anything alike. What is the truth value of the movement? What are they saying? What are their arguments? What are they basing it on? What science? A lot of guilt by association. I like how Natalie, she has enough awareness to know that guilt by association is not a good argument style. Like, she'll say that in the beginning, but then go on to use guilt by association. Like, oh, J.K. Rowling retreated what this lady said, and here they are holding hands. And it's just the assumption that trans is real. That's simply how it is. And that's not true. A lot of name calling, gossip. Yeah, I believe that Natalie's a trans woman. It's like, no, I believe you're a woman because of how you argue, because it sounds like gossip, because you say, oh, can you believe she said that? Oh my God. Okay, that's not an argument. There's a lot of that going on. It comes back to this question, like, can you answer the question, why is racism wrong? I don't think a lot of people can answer that. I think they'll just say things like what Natalie was saying in her arguments, like, oh, that's dangerous, it's shameful, it's cringe. That's not saying anything. Why is racism wrong? I think a lot of people, though, we understand racism to be wrong. And of course it is wrong. But it doesn't matter if if you think it's wrong if you really don't know why it's wrong in the first place. And I think that's coming out here. Like, you're just going, why is racism wrong? Yeah. Well, I think, well, let's go back here. I think the reason why they can't answer this and why they'll never be able to answer this is because when you start looking at why racism is wrong, you look at individualism. You look at, well, because racism is treating people as a monolith. Racism is taking one instance and saying everybody in this race, this thing that you can't control, is not necessarily, part of that monolithic thing, however you define that. Might lead to some self-reflection here. What do you guys think? So just a summary of my views is, yeah, trans is real. It is psychologically real. It's a dysphoria. It's a disorder. It's a way that you act out because you don't know how to deal with the gender that was foisted upon you at birth. And the gender definitely was foisted upon you at birth. And if you have insecurities that you don't know how to manage, and nobody's teaching you about proper anima integration, then you're just going to want to flip the script. That's fine. It's what you do to act out. Like when I take my shirt off, right? When I take my shirt off at the park and say "sun's out, guns out," that's a dysphoria. I think that's funny. I think I look more attractive when I do that. Nothing's more dysphoric than that. But it's got to be honest, right? I'll use their pronouns, right? I'm using she, her for Natalie. I'll use your pronoun. I'm not going to use they, them because that's grammatically ridiculous. But if you are trans, and especially if you're convincing as the sex that you now claim to be, what would there be a problem with the pronouns, right? And I'm also okay with trans kids if their parents approve. So what? I mean, like what are we going to do here? I think in some states, like maybe in Mississippi or Alabama, you can be 13 or 14 and get married with your parents' approval. How is this any different? I think it's ridiculous that a 14-year-old would get married. I would definitely not allow that. But if you're a parent and there's some kind of agreement there, I don't know. I mean, I wouldn't start making federal laws against that. That seems like an overreach. And I'm fine with traditional bathroom use. I mean, if you can't use the bathroom that you want, then that just means you need to be better at being trans. If somebody's yelling at you, like, oh, there's a man in the women's bathroom, you just need to do better. It's just lazy. Nobody's going to call you out if you just present well enough. I mean, I don't understand. And obviously if a private company wants to have inclusive bathrooms, this is just a non-issue. I feel like I'm rambling. And I do absolutely think, I guess I didn't get into this much, but a reason why I need to push back against this, and this is a good reason to be unlicensed. I have all my credits. I mean, if you guys don't know, I have all my credit hours to get my PhD. I have all my clinical hours that I need. I'm just not going to take the test. I'm not going to be licensed. I'm going to actively not be licensed. Because when you are, guess what? You get penalized now for not doing gender-affirming care with people. This ideology has absolutely been taken over by institutions. Institutions to such an extent, I can't be part of it. It is the equivalent. I'm not going to go into it, but it would be immoral. From my ethical standards, it is clearly immoral to be part of the APA and to accept any license by them. I'm not saying all therapists are immoral because they get a license, but I just hold them to different standards because they're not as smart as I am, to be honest. I mean, I don't think chimps are immoral. I apply a different moral code to them. What I'm saying is all other therapists compared with me are chimps. So it's painful when one of the trans kids who they interviewed on this J.K. Rowling podcast said that, look, the medical establishment is behind him. he got his parents to agree. The medical establishment was behind him, so he got his, breast thing done at when he was 15 or 16. And he said it with an air of, well, I went to the doctor, and the doctor said this. I just think this is just more of an indication that this is ideologically infused. These ideas came out a while ago. I mean, go check out the Reams story. The Reams, R-E-I-M, what happened with that kid. This is just really quick. Somebody who was circumcised during the circumcision, a boy. He got part of his penis cut off, and the doctor was like, well, he's not going to have sexually, functioning sexual organs. So what we could do, because gender is a social construct anyways, is just cut his penis off completely, I guess give him kind of a vagina, and he'll just be a girl. And it just led to all these problems. And of course, I mean, that's not like that's not to say that transgenderism isn't real just because this one boy who got his penis cut off wasn't trans or didn't take to the female gender very well and ended up committing suicide. But it does show that an ideology that led to that was alive and well even as far back as the 60s, or maybe this is more in the 70s. So it's just important to speak out against this because it's the institutions have been taken over. And if you just think that this is a fringe idea on the outskirts, well, maybe it is to you, but these ideas are also in key institutions in our country. So it really matters from that perspective, and why I would never take a license from these people, because at what point, well, they're just stupid, sorry. And then when it comes to the sports thing, I say let them compete and then let the culture determine their place. I don't understand why this is such a big deal. Just let them compete. If if the Olympic body wants to acknowledge it, I mean, if culturally people don't, it's just not going to matter anyways that much, is it? I mean, it would be as ridiculous as, I'm not comparing it this, but in principle, it would be as ridiculous as living in a country. I mean, I'm laughing at it, and there was some competition, and a black guy won, and we said, "Oh well, dude, you can't win. You're black." Right? It's like as if some governing body said that. What would we think as Americans? We would that's just too ridiculous. I can't even get through without laughing. It's just too funny, right? It's like a SNL sketch. So what does it matter? It's like the BCS versus playoffs, right? I like the BCS because it just led to more arguments about who was really number one and who really should have been in the national championship game, right? It's just more fun that way. So my takeaways, okay, this went on longer than I thought. We don't have a scientific answer for what causes trans, and that's fine. Even if we had the scientific answer, I don't think it would matter anyways, because we don't have the wherewithal to debate this. If you get to the point where both sides can say trans-affirming care decreases suicide, and they can both point to evidence that clearly shows them to be right, what do? I think that means it doesn't matter what we know, because we don't have the wherewithal. We need to understand this stuff from more of a philosophical, psychological approach. So you need to approach this as either side could be right. It comes down to what do you want to let happen to the other side if you are right. And I think this is the big takeaway that I teased in the beginning, that it comes up in the trans issue that comes up. Well, it presents as the argument with trans and the trans argument with the cis. It presents in each of us in all of our relationships. Because what do you do when you're in an argument with somebody? Now, arguments happen, but when I see an urge to inflict pain on the other person. This comes from resentment within the relationship, right? This comes from not what you're arguing about. This comes from other resentment that you don't know how to process, that you have about the person you're in the relationship with. Let's just say girlfriend, your mom, your dad. And then this resentment comes up. And then you think the argument's about the resentment, but it's not. You're just, you can't do anything else with that. You don't know what it is. Nobody's taught you how to process resentment, and you think, based on your self-awareness or lack thereof, if you were to bring up resentment in this conversation, or if you were even to have resentments in a relationship with your girlfriend or boyfriend, whatever, then that would effectively mean either you're a bad person or the end of the relationship, or both. Do I even need to draw comparison to what's going on now? And of course, symbolically, this is very important, because I think we are struggling with anima and animus integration. We have a huge disconnect between anima and anima, what they mean therapeutically. The masculine therapy, what would typically seen as masculine consciousness therapy, which is cognitive behavioral therapy, and then more feminine, what can be seen as catonic therapy in the form of psychodynamic. And neither side is talking to each other. There's no integration of these two, supposedly different genders, different therapeutic genders. Now, there's people who say, oh, well, I do CBT, or I do psychoanalytic, but also I just use some CBT techniques. That's not integration. That's just using both. That's being in conflict. And we need to understand how they're integrated to see. And I think this whole trans debate is a reflection that we can't do this internally. We cannot, we're either intellectual or we're emotional. If you're intellectual, that means you're right. And if you're emotional, that means you're wrong. That is all because we can't understand that there's no integration of emotions and what they are and what they even mean. In fact, this is what the trans debate is, 100%. I mean, this is how I see the world. So if you think this is crazy, I don't know, maybe I'm crazy. But I think it's all a reflection of that. Yeah. It's all a reflection of the American household of the tuned out dad, and as a compensation, the overly emotional, anxious mother. It's all a reflection of that. And what's the trans relationship with homosexuality, as I teased before, right? When I said this sounds like homosexuality, less evidence for a greater severity of comorbidities. Well, this would be extreme homosexuality. Whatever causes homosexuality, and I'm just taking a guess here, whatever the genetic factors are or environmental factors that cause homosexuality, it happens on a continuum. So at a far end of that continuum would be trans people, possibly. It's abnormal. It is abnormal. No problem with the gays, but it is abnormal. Isn't that why you like it, though? That it's abnormal? It's okay. There's a lot of things are abnormal. I mean, doing those, doing this YouTube channel and all the things that inform it, this is quite abnormal. And you can change it. And to some degree, you can, of course, change your sexuality. It changes, and you can change your gender to some degree. Now, you don't have to. But you can if you want, to some degree, especially if you get at it early. And just don't show up at my kid's party drunk, I think is where we'll end it. Thank you guys. If you have any thoughts about this, please leave it in the comments. There's a contact form on the website. We do free consultations, animusempire.com/schedule. And I wish you all the pain and joy that comes from integrating your opposite gender in whatever way you choose.